is both a physician, he is a practicing psychiatrist, but he's also a full-stack developer programmer who taught himself how to code when he was a kid and studied some computer science in college and has been coding our virtual reality software here at Cedars-Sinai. And it's such an amazing resource to have because, as we talked about yesterday, we can hear from patients, they give us feedback, and by the afternoon, we are iteratively updating the software to reflect the input that we received because we have this in-house capability. But I've asked Dr. Liran to talk today about what are the sort of psychological mechanisms that we think are occurring when somebody uses virtual reality, and how do we unlock the mind's potential more broadly and empower healing through immersive realities. So without further ado, thank you, Omer, for being with us. I look forward to your talk.
Yeah, thank you, Brennan, for that wonderful introduction. So as Brennan mentioned, I am a psychiatrist, and I'm also developed therapeutic virtual reality software. And that used to be a side gig, but gradually it became more and more consuming of my life to the point where now it's pretty much most of it. So I'm going to talk about how we can use virtual reality to unlock the mind's potential and enable healing. With virtual reality, we can find that our minds are much more powerful than people have realized. With our minds, as I will discuss in this presentation, we can change our thoughts, our emotions, and our bodies. So currently I don't have any disclosures, but some of the software that I will be discussing may be commercializable in the future. So I want to preface this presentation by explaining why understanding the mechanism of action of virtual reality is so essential. And to do that, I want you to imagine that I told you that in a trial, we found that a syringe is 50% effective for treating some condition, let's say chronic pain. Of course, immediately your first question is going to be, well, what medication was in the syringe? Just talking about the syringe without addressing what medication was inside of it makes no sense. In the same way, when we hear that a virtual reality trial showed that VR was effective for some condition, I too often hear people say, okay, now virtual reality is effective for that condition. No, it's what software was loaded onto that virtual reality headset. And this is why understanding the mechanism of action is so important, because we need to be able to tailor the software specifically to target a condition and patient population. Conversely, if I told you that a medication, there was a trial for a medication and it showed that the medication was ineffective for some condition, your first thought wouldn't be that all medications are ineffective for that condition. In the same way that if a virtual reality trial showed that virtual reality was ineffective for something, the first question is, well, what software was loaded on that VR that was ineffective? It's not the VR that's ineffective, it's the software. So we have to be very careful about how we design our experiments so that we understand what software specifically to use to target a certain population. So unfortunately, in our world, divisiveness is everywhere we look. And in this way, virtual reality can offer a beacon of hope because virtual reality is an empathy-generating machine. And this is an often overlooked aspect of virtual reality. So that's why I want to start with this. With virtual reality, we can put people in other people's shoes, so to speak, and virtually show them things from a completely different perspective. And many studies have shown that this increases empathy in a way that just showing a documentary or a movie doesn't do to that effect. And biologically, we've evolved to care more about people who are near in our geographical area. This is why when you hear that a child passed away on your street block, it has a very different emotional effect than if I told you that 500 children died in a foreign country 5,000 miles away. With virtual reality, we can break those barriers and take away this innate biological adaptation by putting you in distant places where you can see how different people who are remote to you live, and that creates empathy. The goal here is that we can create a more loving world, a world where people feel closer to each other. In mental health, this is important because it increases global well-being. When it also a way to practice interpersonal connection in a safe place. And I think this can actually revolutionize how we treat interpersonal problems. So the most obvious way that virtual reality can work is through escape. Now, it's interesting to note that empathy and escape are two sides of the same coin, because while empathy connects us to others, escape reconnects us to ourselves. Escape takes us away from our distressing realities and allows us to be in a space where we can focus on ourselves. Through escape, we can have a respite and solace from our everyday struggles. So imagine yourself in this situation where you're in a hospital bed and you are surrounded by 4 white walls. Nurses and doctors come in and out. You're wearing a gown. There's a blood pressure machine beeping. Nothing about that environment is healing psychologically. So if I can give you a virtual reality headset and put you in a healing environment like the beach or the forest or whatever is healing to you specifically, that can have a huge effect on our psychology. And we know that if we're in a good place psychologically, we're also in a better place physically. So that's why we created these scenes. And these are scenes from an application we created called Nature VR, where people can choose from different nature scenes and find an escape. We used nature scenes because of the concept of biophilia. Biophilia is the concept that humans are innately drawn to nature and living things. It suggests that humans have this this innate love for nature rooted in their biology. And there have been studies to show that being in nature can enable healing, both mentally and physically. We found that just offering an escape to patients has remarkable impact. And Brennan showed a video of this. I'm not going to show the same video, but if you remember, this patient was on a lake and had this profound emotional experience, as many of our patients do. So now that we talked about escape, I want to talk about another aspect of virtual reality that is important therapeutically, and that's distraction. And escape takes us away from our surroundings. Distraction takes us away from ourselves. And what I mean by that is that what we're trying to achieve is take people away from their own distressing thoughts and emotions. The way we do that is through several means, but for example, in the Nature VR application, we have random events occurring in the environment. For example, a bunny hopping near you or birds flying around, and we have all these random events to try to distract people from their own thoughts. So humans didn't evolve to be in two different places at the same time, and therefore they also didn't evolve to be thinking about two different things at the same time. So if I can distract you and immerse you in the environment, you completely forget where you are and what you were doing. You also forget that you were in pain and that you had negative emotions. And for a while, you have this respite. Being able to multitask is an illusion. And we can take advantage of this fact when we're designing virtual reality software. So another aspect that's kind of related to this is the idea of flow. And many things can produce flow, for example, high-risk activities. And what I mean by flow is that flow is a mental state in which we feel completely immersed in the environment and totally focused on it. It's been described as a feeling of timelessness and being fully in control. Now, flow can be achieved by high-risk activities like base jumping here, but that has an inherent risk of death. So virtual reality can also cause the feeling of flow without that fear, and I can discuss a little bit about how virtual reality can do that. But it's important to note that flow has been associated with increased happiness and decreased stress. Other things that can cause flow is meditation and psychedelics. Meditation can cause flow, and it's a great way to achieve flow. Unfortunately, it requires hundreds or thousands of hours of practice to be able to do this effectively. And most of our patients aren't willing to dedicate that much time because until you actually get to that state, it can be very frustrating to patients. Virtual reality is a shortcut to achieving flow. Without having to put in hundreds or thousands of hours, you just put on the headset. And I'm not the first to note that there are some similarities between psychedelics and virtual reality. Now, of course, the mechanism of action is very different, but they share some common endpoints. For example, both psychedelics and virtual reality have been shown to alter states of consciousness and allow us to see perspectives that differ from our everyday realities. They also both have been shown to increase emotional processing. And also, they both increase empathy. So how do you achieve flow through virtual reality? You can you can have people do some challenging task that has immediate feedback. And once people get pretty good at that task, they just enter this flow state, and they can do this task almost automatically while feeling the effects of flow. Any gamers in the room will know that playing video games can also induce flow. However, it's much easier to achieve in virtual reality, and also it's very difficult for non-gamers to achieve flow by playing games, because again, you have to get very good at the game to achieve flow through it. And this is not something that many patients are able to do. Associated with flow is a time-elapsed compression effect. Studies have shown that people in virtual reality feel the passage of time to be 20 to 40% faster compared to even the same task on a 2D screen. Now, when would this be important? Well, for example, when someone is getting chemotherapy and they spent many hours in the room getting chemotherapy, being able to shorten that amount of time by 20 to 40% is a huge deal. Also, for people with limited attention spans, like in the pediatric or geriatric population, that can also be a huge deal. And even during therapy sessions, when people have to talk about their emotions and have these long conversations that are disturbing to them, being able to compress the time elapsed will allow people to spend more time in this therapy session. Virtual reality is also especially good at allowing people to learn new skills. Now, everything we talked about so far really heals people in the moment. But by learning new skills, we can change our brains to have lasting effects. And pain is inevitable. Suffering is optional. What I mean by this is that we can change, by changing, we may not be able to change our elements, but the way we process our thoughts, we can change our emotions and our bodies associated with those elements. So we know that cognitive behavioral therapy, or CBT, is very helpful to patients. And very briefly, in CBT, the idea is that if we can change our thoughts, well, our thoughts control our emotions and behaviors. And then those in turn control our thoughts. And this can create a cycle, feedback loop. So the idea here is that if we can catch our thoughts, examine them for biases, and then restructure them into more positive thoughts, we can regulate our emotions and behaviors. And we know from decades of research that CBT is very effective for many different elements. The problem here is that there are very few CBT therapists. And there's a huge shortage, and that shortage is just getting worse. Moreover, most people, especially from disadvantaged areas, don't have access to CBT therapists. And most CBT therapists don't take insurance. They take cash only, because insurance companies just don't compensate them enough for their work. So what we did in our application is we have this room called theater of the mind, where we project people's thoughts onto a screen as a metaphor. People learn how to recognize different destructive thoughts and how to relabel them so they are more positive and have this healing potential. Here, people are learning about, for example, catastrophizing, which is an automatic thought that people have where they think that everything is going to go wrong and that the world is going to end because of one thing. And anyway, we go through many of these things and gradually teach people through repetition how to recognize these thoughts. So in Nature VR, we also have this lake scene, which is just a beautiful backdrop, and where people here are doing breathing exercises, where there's a breath ring and particle effects showing people the correct breathing rates. And people can choose from 6 different rhythm rates, depending on what effect they're looking for. And again, we know from decades of research that doing breathing exercises helps people with anxiety, pain, and many other things. So why aren't all patients just doing breathing exercises? Well, that's because, again, it takes practice and dedication. And there are mobile apps for this, for example. But honestly, those are kind of boring. It's hard to sit there for 15, 20 minutes with a phone app in front of you and doing breathing exercises when you're still in a distressing environment all around you. With virtual reality, we can change that. We can put people in peaceful environments where they can be in this space for a long time. The particle effects are interesting to look at, and they give you visual cues on the correct breathing rate. Virtual reality has also been shown to be very effective for teaching people in a lot of different, just in education in general. And that's because people get this emotional experience in virtual reality that they don't get through other media. And everybody learns by experience. We're all human. Some may learn better from reading or watching TV or watching a lecture, but everybody learns from experience. So putting people in an experience allows people to have better retention of information. Okay, so what we did is we used virtual reality, and this is a paper that I published a few years ago, to show people with HIV and teach them about their disease. And the idea was that by teaching people about their own illness, we may be able to change their behavior and their adherence to medications. The problem is that about 50% of patients with HIV don't take their medications as prescribed, and this has huge implications for their health. So there have been other studies trying to show them documentaries and videos, getting doctors to talk to them, but none of those worked. So I had the idea of actually showing people in virtual reality, giving them an experience by shrinking them down into a blood cell and actually showing them what HIV is, what a virus is, what the immune cell is. Because most people don't know what immune cells are. They don't even know that humans are made out of cells. We take that for granted as healthcare professionals. And when the doctor tells that to the patient nods, but really has no idea what the doctor is talking about. But after this experience, people have a much better understanding. And right here, the immune cell that you can see here, the white blood cell here that is infected and is about to burst, releasing HIV. This is meant to be very dramatic. There's dramatic music. There's a bacteria here spewing this green poison. And the experience was meant to be scientifically accurate, but dramatic. We then give patients a button to press to pump medications into the bloodstream. And we see patients, they just need to press the button once, but we see patients really smashing away at that button. And what they see is these gold particles covering the white blood cell with a shield. And we teach them that if they don't take their medications, that shield is going to wane. And eventually, they may feel fine in the moment, but eventually that shield is going away, and the HIV particles can reinfect the cell. And this actually had a dramatic effect. This was a pretty small pilot study, but we showed that not only did patients report in a follow-up that they take their medications more often, their viral loads actually decreased. As opposed to serial viral loads taken before the virtual reality experience that showed no decrease. We also take advantage of virtual reality's ability to educate patients in our irritable bowel syndrome app, where patients do a role reversal exercise to learn about irritable bowel syndrome. Here's a short excerpt.
Here, take this stethoscope. I'll show you how to use it. Now place the stethoscope over Taylor's stomach, and you'll be able to listen to what is happening in her gut. I hear a lot of rumbling sounds and some pops or clicks. We should investigate what's happening.
All right. It goes on to show you holograms and X-ray images of inside, so that people really get an intuitive feel for what's going on. And the idea is that we really want to stress the importance of the brain-gut connection, so that people can then go into the CBT module having that idea implanted into their minds. So I also want to talk about how virtual reality can give people new perspectives. And you just saw an example of that where people did a role reversal exercise. And we also talked about that through empathy. But new perspectives can not only connect you to others, it can reconnect you to yourself and give you new tools to conquer your own ailments. For example, there was a study, a famous study from the Netherlands that looked at patients with anorexia, which showed that patients with anorexia, typically they overestimate their body size. But after recalibrating through virtual reality, they were able to have much more accurate measurements. And in 2018, a meta-analysis concluded that VR is an acceptable and promising therapeutic tool for patients with eating disorders. We take advantage of this, allowing people to have a new perspective in our IBS VR app by having people assume the body of this shadowy figure. And across from them, they see this higher being, very powerful, fantastical being. And people are asked to talk about things that are distressing to them. And then they press a button, and they have a mind shift where now they assume the role of this higher being, and they're told to reply to their shadowy figure in a way that maybe a friend would. And it turns out that when allowed to see themselves from a third-person perspective, and in this case they see and hear themselves because we record the body movement and the speech, people actually have answers to their own questions much of the time. And lastly, I want to talk about exposure. Right now, exposure therapy is very common in clinics, but people are asked to imagine things in the clinic. For example, imagine spiders, because it's very impractical to actually bring spiders to the clinic or take people high up on the roof to look down. Through exposure, through virtual reality, we can make exposure much more practical because we can actually show them spiders, we can show them increasing heights. We can change it specifically for the patient's need. And exposure has been shown to work for phobias, social anxiety, panic disorder, and PTSD. We use exposure therapy in combination of CBT in our app by allowing patients with irritable bowel syndrome to choose from 6 different scenarios that they have told us were distressing to them. Here's a short excerpt.
So imagine yourself in this situation. You're on the toilet in a busy public restroom. You've been there a while. People are waiting for the stall within earshot. You notice that you're making loud noises. Imagine yourself in this situation as best you can. As you imagine being in this situation, what feelings does this scene trigger in your mind? Take a look at this list.
Yeah, so now we have a cognitive behavioral therapy in the stall where the person finds distressing. So the idea here is that next time they find themselves in this kind of situation in real life,
keep imagining you're in this unpleasant
they are
situation,
better equipped to deal with it because they've went through this in virtual reality. They've been exposed to it many times before. And I'm going to end by actually just reading this off the slide because I think this statement is so profound and important and true. By leveraging the power of virtual reality and integrating evidence-based therapy techniques, we have the potential to transform mental health treatment and enhance the quality of life for billions. So thank you very much. I appreciate your time.